Hi, welcome to the PKS classes. Today we will study the difference between sympathetic nervous system and parasympathetic nervous system. Okay. First, let us start with eye. On eye, there are three parameters. One is the pupil size, two is the intraocular pressure, and third is the lacrimal secretion. So first we will discuss the pupil size. Suppose our eye, and in the eye, if this part we see, then this will look like this. Okay, and in this is the smooth muscle and this is the gap. Okay, this part is the consists of the smooth muscle and this is the gap. Okay, this gap is called the pupil, and this part is called iris. And this iris contains two types of muscle, smooth muscle. One you can see here, radius like, so radial smooth muscle, and the other one is circular, so that is called circular smooth muscle, and these two together is known as iris. Okay, and sympathetic nervous system is supplied to innervated to radial smooth muscle. Parasympathetic nervous system is innervated to circular smooth muscle. Okay, so when sympathetic nervous system is activated, this radial smooth muscle is contracted. So you can see, so this is the pupil and these are the radial smooth muscles. So irrespective of circular, we will see only the radial. Sympathetic nervous system is innervated to the radial smooth muscle, and this radial smooth muscle contraction will be there, and there are alpha 1 receptors, okay, on the smooth muscles, and this contraction will occur means this will be this way, this will be contracted like this. So these are contracted, and because of this contraction this pupil size will increase. So radial smooth muscle contraction will be there and pupil size will increase, and this condition is called mydriasis. Okay, sympathetic nervous system causes mydriasis, whereas in case of parasympathetic nervous system, the circular smooth muscles are there, and the circular smooth muscle contracts means this will be contracted like this, and because of that the pupil size will decrease, and that condition is called meiosis. So sympathetic causes mydriasis, parasympathetic causes meiosis. And the second one on eye, the autonomic activity is intraocular pressure. So if we are intraocular tension, and that is the pressure caused by aqueous humor on the lens. So if you take a transverse section of this one, this will be like this. Okay, and this is called ciliary body. Okay, ciliary, this is ciliary muscle, and this is called the ciliary process. And together these two are called ciliary body. Okay, and parasympathetic nervous system is innervated to ciliary muscle, and there is no sympathetic innervation. Okay, so parasympathetic innervation causes ciliary muscle contraction. So if this will be contracted, like this. Okay, and this is called canal of Schlemm. What is the function of this canal of Schlemm? So when this aqueous humor is released, this aqueous humor now is drained through this canal of Schlemm. Okay, so drainage of aqueous humor, its function is drainage of aqueous humor. And aqueous humor puts pressure on the lens, and that pressure is called intraocular pressure. So when parasympathetic nervous system is activated, the ciliary muscle contracts, and because of ciliary muscle contraction, what will happen? There will be opening of this canal of Schlem. So canal of Schlem opening, so opening of canal of Schlem will cause drainage of aqueous humor, and when the drainage of aqueous humor will be there, there will be less aqueous humor here, so less pressure, so it decreases the intraocular tension. Okay, and this is all through M3 receptor. Okay, and in the sympathetic case, there is no innervation, but receptor is there. Okay, so because of that, so because alpha 1 receptor is there, and here it is causing relaxation. So ciliary muscle relaxation, and ciliary muscle relaxation will lead to increase in intraocular tension because there will be no drainage of aqueous humor. Okay, and when intraocular tension increases, that causes glaucoma. Okay, so sorry, here beta receptor is there, beta, so beta blocker, beta 2 receptor is there, beta 2 receptor, so beta blocker can be used in glaucoma. And the third one in case of eye is the lacrimal gland. So lacrimal gland, and any gland and secretion is there, so secretion will be by parasympathetic. So secretion from any gland means it is parasympathetic activity, and there is no secretion in case of sympathetic activity. So after eye, we will go to nose, same nose nasal secretion, and nasal secretion in case of sympathetic there is no secretion, parasympathetic is there. Mouth means there is saliva secretion, saliva again parasympathetic activity, no sympathetic activity. Then bronchi and bronchioles. Okay, bronchi and bronchioles, here again only parasympathetic innervation, no sympathetic innervation, but beta 2 receptor is there. So because of parasympathetic innervation, there will be bronchial smooth muscle contraction, so causing bronchoconstriction. And if there is no sympathetic innervation, and bronchoconstriction will cause asthma. But beta 2 receptors are present, so if we give drugs acting as beta 2 agonist, then they will be like salbutamol, terbutaline, they will be bronchodilators and can be used in treatment of asthma. And in bronchioles there is another one, bronchial secretion, and as we discussed, bronchial secretion, again secretion means it is a parasympathetic activity and there is no sympathetic activity. Then we will discuss the heart. In heart and sympathetic we have heart beta 1 receptor, and in heart also M2 receptors are there, and dominant is the sympathetic one, which causes increase in heart rate. Increase in heart rate is called positive chronotropic effect. So there is decrease in heart rate, that means negative chronotropic effect. Okay, and there is increase in force of contraction, that is called positive inotropic effect, and here it is decrease in force of contraction, so negative inotropic effect. Okay, and this increase in force of contraction increases the stroke volume, and we know increase heart rate into stroke volume is equal to cardiac output. Okay, so cardiac output is increased because of sympathetic action, and if you compare the sympathetic and parasympathetic action in heart, sympathetic one is the dominant one and parasympathetic is the less dominant. And if we see the blood vessels, blood vessels, we know there are smooth muscles, and the receptors here alpha 1 and here it is M3. So alpha 1 receptor causes vasoconstriction. So the peripheral resistance increases. Okay, and here actually acetylcholine in small dose produces vasodilatation. In small dose it produces vasodilatation, but in large dose it causes vasoconstriction, because we know in the ganglia, CNS ganglia, and then in the periphery. So in the ganglia, acetylcholine is the main neurotransmitter. If we give the large dose of acetylcholine, then this ganglion will be stimulated, and since this is a sympathetic dominant action, so there will be vasoconstriction. In small dose, it causes vasodilatation because of this postganglionic action. This is postganglionic action. Okay, and in large dose, acetylcholine in large dose causes vasoconstriction because of ganglion action on the ganglion. Okay, because acetylcholine is the neurotransmitter here, and we know that cardiac output into peripheral resistance is equal to blood pressure. So cardiac output is increased by sympathetic, peripheral resistance is increased by sympathetic. So blood pressure is increased by sympathetic. Okay. Next, in GIT, again two types of actions will be there, because in GIT there are smooth muscles, and smooth muscles there is beta receptor. So smooth muscle relaxation will be there. So smooth muscle relaxation will cause decrease in GI motility. So GI motility, peristaltic movement decreases, whereas here M3 receptor is there and causes smooth muscle, GI smooth muscle contraction, and this causes increase in motility. Okay, so sympathetic stimulation causes decrease in motility, parasympathetic stimulation causes increase in motility, and the second one is the secretion, GI secretions. And secretion, as we already discussed, secretion means parasympathetic, no sympathetic, and here the receptor is M1. Okay, so there is secretion of gastric acid and other secretions from the GIT. Next, liver. In the liver, the autonomic activities, two autonomic activities are there. One is bile secretion, and secretion means it is only parasympathetic, no sympathetic. And second is the maintenance of glucose level. Glucose level, as you know, maintained by the processes like gluconeogenesis, okay, glycogenesis or glycogenesis and glycogenolysis. Okay, so gluconeogenesis is increased, glycogenolysis is increased, breakdown of glycogen to glucose, glycogenesis is decreased, and all these causes hyperglycemia. Okay, bile secretion is regulated by both sympathetic and parasympathetic, means only parasympathetic, not sympathetic. However, glucose level is regulated by only sympathetic, no parasympathetic. Okay, and glucose level by increasing gluconeogenesis, glycogenolysis, and decreasing glycogenesis, there will be hyperglycemia. So hyperglycemia is a sympathetic action. And gallbladder. So gallbladder, the release of stored bile, parasympathetic action. So gallbladder is the store of bile. So stored bile is released by parasympathetic action, and here there is inhibition of release. This is the sympathetic action, inhibition release of stored bile. And gallbladder also contains the smooth muscles. Here in sympathetic there is relaxation of smooth muscle of gallbladder because of beta 2 receptors, and there is contraction of smooth muscle of gallbladder because of M3 receptors. Then we'll go to pancreas. Pancreas, two secretions are there. One is insulin and glucagon. So there is inhibition of insulin secretion and increase in glucagon secretion. This is sympathetic action because we know there is hyperglycemia. And here parasympathetic increase secretion of insulin and other pancreatic enzymes. Next we'll go to spleen. Spleen, there is contraction of spleen in case of sympathetic, and because there is no parasympathetic, no innervation to spleen, only sympathetic, so contract spleen and discharge stored blood into general circulation. Then we will go to kidney, and in kidney there are two actions. One is renin secretion, and renin secretion, this is again sympathetic activity, no parasympathetic innervation. So renin secretion activates the renin-angiotensin system, and renin-angiotensin system, this is again beta 1 regulated. Okay, so kidney secretes renin-angiotensin system activates, and this will increase the blood pressure. And the second action on kidney autonomic action is urine volume, and this urine volume will be decreased by the sympathetic action. There is no parasympathetic action. And ureters, we know smooth muscles, so smooth muscle contraction because of alpha 1 receptor in ureters, and there is increase in motility of ureters, and here there is M3 receptor and decrease in motility of ureters. Then we'll go to the urinary bladder. And in urinary bladder, if we draw the diagram, so here this is called detrusor muscle. This is the trigone, and this is the sphincter muscle. And in urinary bladder, detrusor muscle, we have beta 2 receptor, and sphincter muscle we have alpha 1 receptor. So there will be detrusor muscle relaxation and sphincter muscle contraction in case of sympathetic, and that will cause that urine is present here, so urinary bladder, urine will be retained. So urinary retention is the sympathetic action. Just opposite is the parasympathetic action, detrusor muscle contraction and sphincter muscle relaxation, and that will cause micturition. So there will be urine output would be there. Okay, cannot retain. Okay, so the person will start micturating. And few more are there. Now let us come to uterus. Uterus only sympathetic, there is no parasympathetic, but the distribution of receptors differ in non-pregnant and pregnant. Non-pregnant and even first 2 trimesters of pregnancy. There are 3 trimesters in pregnancy. First 2 trimesters there is beta 2. So uterine smooth muscle relaxation in non-pregnant uterus. Whereas in pregnancy mainly in the third trimester, the final trimester of pregnancy, there is distribution of alpha 1 receptors mainly, and there will be uterine contractions. Okay, and there is no parasympathetic action. And next, sex organs. Sex organs, smooth muscles are there. So in sympathetic nervous system is supplied to smooth muscle of vas deferens. Okay, so that will cause ejaculation of semen. And in parasympathetic, as you know, there is vasodilatation. So vasodilatation will cause erection of penis in male and erection of clitoris in female. So erection in both sexes is caused by parasympathetic because of vasodilatation. And if you see the skin, in skin, two actions are there. One is sweat gland, sweat secretion, and though it is a cholinergic action, this is one exception. At the postganglionic nerve ending, there is cholinergic action and receptors are M3. Okay, but it is sympathetic because it is coming from the thoracolumbar outflow. So sweat gland secretion is sympathetic and there is no parasympathetic action. Sweat gland secretion M3, but it is sympathetic. And again there is exception, secretion from palm and sole, not occurring in all the individuals, in few, secretion from palm and sole, that is alpha receptor involved. Otherwise it is mostly M3 receptor involved. And the second autonomic action is piloerection. Piloerection is erection of hairs, and erection of hairs, again it is a sympathetic action, no parasympathetic action. Final one, the adipose tissue. And adipose tissue, the fat tissue, only sympathetic, no parasympathetic. Beta 3 receptor is there, causing lipolysis and release of fatty acids into blood. So from this we can say that there are certain actions in which sympathetic is dominant and there are certain actions in which parasympathetic is dominant, and will increase the sympathetic action, and a sympatholytic drug decrease the sympathetic action, and a parasympathomimetic drug increases the parasympathetic action. A parasympatholytic drug decreases the parasympathetic action. Okay, and when we give a sympatholytic drug, that means you can see that these sympathetic and parasympathetic actions, they just act opposite to each other. Not in all cases, because in some cases no parasympathetic innervation is there, in some cases no sympathetic innervation is there. So if sympathomimetic drug, this is the equilibrium we say, so sympathetic and parasympathetic, they maintain this equilibrium. Suppose this is sympathetic, this is parasympathetic, and when the sympathomimetic drug is given, this equilibrium shifts towards sympathetic. And when the parasympathomimetic drug is given, this equilibrium shifts towards parasympathetic. So when a sympatholytic drug is given, this becomes weaker, so it shifts, the equilibrium shifts towards parasympathetic. So sympatholytic actions are more or less similar to parasympathomimetic. Similarly, parasympatholytic drug, this becomes weaker and the equilibrium shifts towards sympathetic. So parasympatholytic drugs show similar actions to that of sympathomimetic. Not in all organs, where both sympathetic and parasympathetic are given. So thank you.